I can't.
All right. Apologies, everyone, for the late start here. We had a bit of a technical issue, but I think we have it all sorted out now. So apologies for starting a few minutes late, but thank you very much for attending and participating. This is my name is Clark Collins. I'm the Deputy Director of Benefits and Wellness, if you don't know who I am. And this is the third day of the State of Vermont's virtual benefits fair. Usually our benefits fair is held during the flu shot clinics, and we have tables for our vendors to engage as people go through. But this year with the pandemic, obviously that's not really a viable option. So we decided to switch this to a virtual format. So far, we had Blue Cross Blue Shield on Monday and Express Scripts yesterday. Today we have our flexible spending account and dependent care account vendor here to talk about the benefit and hopefully give some good information for everyone. Just a reminder that we will continue to have presentations on Thursday and Friday from 12 to 12:45. And just a couple points of housekeeping before we kick it off. Just make sure you keep your mics muted at all times to avoid disruption. And if you have a question, please go ahead and send it through the chat function. At the end of the presentation, we will have a moderated question and answer session, and we'll run through the questions as they come up in the chat function. So I'll be looking at it as we go along, collecting the questions, and hopefully we can get through all the questions at the end. Just one thing to keep in mind is that this is not, the presentation is actually being recorded and it's not confidential. So please don't ask any personal situation questions. Try and keep the questions more of a benefits level type of questions. And actually with that, I'm going to pass the mic over to Kalina and Bob, who are here from ASI to talk about the flex spending benefit.
Good morning. This is Bob Olson with ASIFlex, and welcome to the State of Vermont Flexible Spending Account presentation. During this presentation, we're discussing your options for 2021. Now, first, let's just take a quick look at FSAs. The flexible spending accounts are year-to-year accounts, and you must re-enroll each year. These accounts allow you to set aside money from your paycheck pre-tax to pay for out-of-pocket health care and dependent care expenses, those expenses not covered by insurance. There are two FSA accounts. There's the healthcare flexible spending account that can be used for healthcare expenses. This can be medical, prescription, dental, hearing, over-the-counter products. And then there's the dependent care flexible spending account. That can be used to pay for work-related child daycare expenses and in some cases, elder care expenses. This includes such things as baby food, before or after school, nursery or preschool, and day camps, but not overnight camps. Remember, this is work-related expenses while you, and if married, your spouse are working. Now, let's talk about how does the FSA work. First, you want to estimate the expenses that you're going to have for the coming year. Once you've come up with a total, divide that number by the pay periods that you have in 2021. You will make pre-tax contributions to your FSA each pay period. Then, of course, you'll incur eligible expenses, submit claims for those expenses, and get reimbursed. Now, the IRS regulates FSAs, so we do have to follow some rules. But there are simple guidelines to keep in mind. First of all, you must enroll every year with a new election. Just because you were enrolled last year does not mean that you'll automatically be enrolled for the coming year. You must spend all funds during the year, Expenses must be incurred during your period of coverage or plan year. And with your plan, that would be January 1 through December 31 of that year. You do not have to be covered under any other healthcare plan to take advantage of the flexible spending account. You can also use it to pay for expenses for your spouse and dependent children. Once you make the election, however, it remains in effect for the plan year unless you experience a qualified status change. That would be something like a marriage, an adoption, the birth of a child, those type of things that will then allow you to make changes to the plan. You can access all of your healthcare funds anytime during the year. So that means literally in January of 2021, you have access to all of your healthcare funds for the entire year. Funds remaining at year end are forfeited, however, and there is a $550 carryover provision for the healthcare FSA, which means that if at the end of December, you've got 550 or less in your account and you re-enroll for the coming year, that 550 will be carried over into the new year in your healthcare account. How to avoid forfeitures. It's something that we all talk about, and it's really easy, but it does require some planning. You want to plan for the predictable and recurring expenses you're going to have during the course of the year. Expenses you know you will have during that year. Those are sort of the easy ones. Then review the prior year expenses to use as a guide. If you know something is going to occur again, then build that into your numbers. Be conservative, however. And to help you with all of this, we provide online tools at www.asiflex.com. There's an expense estimator. There's a listing of eligible expenses so you know what you can build into your account. There's a contact point for the FSA store at fsastore.com that'll provide you resources for the over-the-counter products that are eligible. And believe me, there are literally thousands of them. And again, as I said earlier, remember, you can carry over into the following year, which would be 2022, up to $550 from your account. Okay, let's talk about healthcare expenses. First of all, your FSA has minimum and maximum contribution levels. And the maximum is new for 2021, $2,750. The minimum is $130. Now, the healthcare FSA can be used for prescriptions and office visits, co-pays, deductibles, x-rays, lab, hospital expenses, even mileage to and from your healthcare provider. It can also be used for over-the-counter items. And this is what I was telling you about earlier at the FSAstore.com, that you can see these items listed. And they run the gamut from Band-Aids and sunscreens to blood pressure monitors and medical supplies and drugs. Vision is also eligible for reimbursement under the healthcare FSA. The exams, eyeglasses, prescription sunglasses, contact lenses and solutions, reading glasses, even something like LASIK surgery. Dental is also covered with x-rays, fillings, crowns, bridges, dentures, even adhesives. And hearing is also eligible under the healthcare FSA, and that can be the exams, the actual hearing aids, even things like batteries. The items that are available over the counter have been expanded. This occurred in 2021 and 2020, excuse me, and will continue into 2021. Like for instance, menstrual care products have been added to the list. Over-the-counter drugs and medications no longer require a doctor's prescription to qualify under your FSA account. Now that was the healthcare FSA. Now let's talk about the dependent care FSA. Unlike the healthcare flexible spending account, the dependent care flexible spending account allows for from $130 up to $5,000 in annual contributions. There is a caveat, however. If you're married filing separate returns, each filer is permitted up to $2,500. The dependent care FSA can be used for babysitting while you're at work, preschool or nursery school for young children, before school or after school care, day camps, but they cannot be overnight camps, and adult care ages 13 and older. These would be qualified dependents that require care while you are at work. Now let's review the multiple claim filing options that are available. First of all, the online filing at www.asiflex.com. You can use the mobile app. There is an ASIFlex debit card, our fax, and our mail. Now, we've got something new to tell you about today that we're going to be rolling out starting actually Monday, and that's the ASIFlex exclusive payment arrangement with the FSA store. If you utilize the FSA store for over-the-counter items, you can link it to your account and you have a cardless pay option with no requirements for documentation. Just another way to make the utilization of the FSA store and the securing of your over-the-counter products a little simpler for you. Now, let's talk about the ASIFlex mobile app. It's free. There's a video tutorial on asiflex.com. So don't be intimidated. It's going to be difficult. This tutorial will walk you through the steps that you need to take. You can use it on a smartphone or a tablet. You simply snap a picture of the documentation and you can do it right from the pharmacy, the doctor's office, or the dental or vision office that you're visiting. And you can check your balance 24/7. With your online account, you're going to be able to register to view online account statements, read any secure messages that may involve questions of documentation on a claim, and you'll have the ability to submit claims. The next method of payment, of course, is the ASIFlex card, and it's free. It's a health benefit card. It provides an easy way to pay for merchants or a healthcare provider directly from your healthcare reimbursement account. Please remember, use of the debit card is not entirely paperless. In some cases, you may be asked to submit documentation to substantiate your card transactions. If you do not currently have an ASIFlex card, a free set of 2 cards will be mailed to healthcare recipients this coming year. Current card holders, however, keep your card. It'll be simply reloaded with the 2021 election amount. You can visit asiflex.com/debit cards for more information and a quick guide to the usage of the card. We always say it's swipe, ask, and go. How to use the card. Swipe the card and sign or enter your PIN. Ask for the itemized statement, and you're on your way. The card is accepted at healthcare and retail providers that accept Visa. It's not accepted at restaurants, gas stations, department stores, etc. The IRS has specific regulations governing use of the card, and ASIFlex is charged with maintaining compliance of the program. Remember to save the itemized statement and the insurance plan, EOB, the explanation of benefits when applicable, in the event that you're asked to submit. You can submit this required documentation via mobile app, online, or by using our toll-free fax. IRS regulations require employees to provide documentation to substantiate some claims. ASIFlex also provides an educational video at www.asiflex.com explaining the documentation requirements. A little section there, how to file claims. These requirements are the same regardless of the method of claim submission or claim payment. They are the who, what, where, when, and how much. Now, let's talk about types of documentation required. If you're covered by insurance, be it medical, dental, or vision, the first thing you need to do is submit the claim to your insurance payer. The insurance provider will then give you an explanation of benefits or itemized statement. Note, always submit to the insurance company first. Then the remaining balance on the statement you can submit under your account. If you're not covered by insurance, then supply the itemized statement as your claim reimbursement. Prescriptions, you'll need the pharmacy receipt or a printout from the pharmacy, or if you're using mail order, an itemized mail order receipt. Over-the-counter healthcare products, drugs, and medicines, as I said earlier, no longer require a doctor's prescription, and all you need for submitting that is the itemized merchant receipt. Don't submit credit card receipts or paid on accounts balances or canceled checks. Those are not needed or required. Let's talk about going green. In addition to helping the environment, it also has a lot of benefits for you. Sign up for email or text alerts. Avoid the paper notices and delays that may occur in the mail. Have the payment sent directly to your bank, a direct deposit. That helps you avoid the hassle of paper checks and, again, delays in the mail. File claims with the mobile app or online. It's quick, it's easy, and the results in rapid claim payments. And if you are doing dependent care, have the dependent care provider sign your claim form, and no other documentation is required. Set up your own personal settings. Sign up for electronic communications, email or text, and direct deposit to your checking account. At www.asiflex.com, you can access your FSA account detail, review your messages, manage all of your personal settings, You have extensive eligible and ineligible expense listings to which you can refer. The FSA store that we've talked about with thousands of eligible FSA products. There'll be the frequently asked questions section that may help you with questions that you have. And as we talked about earlier, when you're trying to estimate the amount for contributions for the coming year, there's an expense estimator and tax savings calculator. There are also educational videos and some IRS forms and publications that may be helpful to you during the course of the year. Now let's talk about important dates. You must re-enroll, as we said earlier, and your open enrollment dates for 2021 are the month of November 2020. Claims must be incurred, meaning you have to receive the services or products between January 1 and December 31. And the deadline to submit claims is March 31st of the following year. But don't wait until the last minute, as we don't want you to miss that date. If you have any questions, ASIFlex customer service is available to assist during extended hours, 8 a.m. to 8 p.m. Eastern Standard Time, Monday through Friday, and 10 a.m. to 2 p.m. Eastern Standard Time on Saturday. And remember, you're going to talk to a live person. You're not going to be put into a phone tree or anything like that. When you call this number, you will talk to someone at ASIFlex. We have our website for contact, our email, our 800 phone number, and of course, our mailing address. We want to thank you today. ASIFlex is honored to be servicing the state of Vermont. Now, as we've been reviewing the state of Vermont plans, we've been receiving questions. So I'm going to turn this segment over to Clark Collins with the state of Vermont and Kalina Kohlmeyer, the ASIFlex Senior Account Manager, who's responsible for the state of Vermont. Clark and Kalina, it's all yours.
It's a great presentation, and it covered a lot of information. And thankfully, we've had a lot of questions come in while you were giving it. So I'm going to start to run through some of those. We had a question whether the state vision plan covers up to a certain amount for frames and glasses and lenses when you need them. Are any of the extras covered under the flex spending, like transition lenses, scratch resistant coating, that kind of thing?
So yes, all of anything applying to your glasses or the vision wear that you need, contacts, that is all covered under the FSA. What wouldn't be covered is personal use items, such as a lanyard for you to carry your glasses around your neck, eyewear protection plans. Those are a warranty, so they actually aren't necessary for the medical need of the glasses, so those wouldn't be covered. But if you're getting transition lenses, bifocals, prescription sunglasses, those are all eligible. Clip-on sunglasses that just clip over your eyeglasses would be classified as personal use because they don't have the prescription in them, but prescription sunglasses would be eligible.
Okay, great, thank you. The money, the rollover money, this specific question was if you roll over $100 from, let's say from 2020 into 2021, can the expenses from 2021 be used with that $100? Meaning the money you roll over, is it usable in the following year? And actually, now that this question comes up, my mind also went the opposite way, meaning if you roll it over, can you use it for expenses that incurred the previous year in the grace period?
So your funds that are carried over into your new plan year will be available immediately in your new plan year, and you can use those expenses in the new plan year of 2021 with the carryover funds. However, through that March 31st date, you can actually also use those funds for prior year expenses. So you would either, if you're carrying over $100, which I know was the example in the question, up to March 31st, if you have an expense under 2020 that you had not yet submitted and need reimbursed for, then that 100 could go towards that expense. But if you don't have any additional expenses for 2020 and those funds have carried over into 2021 and you have an expense, let's just say, let's go after March 31st, just to be safe, or even before, but July 1st, then yes, that 100 will be available with your election that you make, or if you choose not to make an election, you still have those carryover funds as long as you're working for the state of Vermont, and you'll be able to use those funds for your expense to be reimbursed.
Excellent. Excellent. Thank you. Let's see. Next question. I know in one of the slides that was talking about the dependent care accounts, Bob had mentioned that you could use it for babysitting. Can you sort of go through that a little bit? What kind of documentation you need? Like what kind of, I mean, define babysitting, I guess, is what we would need to know.
Well, I mean, there's multiple forms of care for your dependents. So you could use a daycare, which with 2020, a lot of those daycares closed and people had to find alternatives. So babysitting falls within that. And this was eligible prior to this year. But babysitting can be done by a family member as long as they're not classified as a dependent of yours, or by, you know, a neighbor, a friend, whoever you have hired, a nanny. Those expenses would qualify the same as a daycare, as long as that babysitter or nanny is being used for the purpose of you maintaining work full time. Now, it couldn't be babysitting expenses if you go out on the town in the evening, but if you're working and you need a babysitter, then they would qualify. We do request supporting documentation, of course, for dependent care expenses, but some of you may be aware, others may not. On our claim form, when you go to submit that claim, there's an option under the dependent care section that allows for the provider, who would be the babysitter, to sign and date to verify that the information on the claim form is accurate. And that replaces supporting documentation. So we wouldn't necessarily need an itemized statement showing the services for care with that claim form. If you're submitting online or via the mobile app, since obviously the provider cannot sign electronically with you while you are submitting that, you can actually have them sign the paper claim form and then submit that claim form with that signature and the information filled out on it as your form of supporting documentation through online or the mobile app.
All right, thank you. I think that answers that question. The store that Bob mentioned, the ASI store, is there a way that people can access that to see what's available before they enroll? So this is someone who isn't currently enrolled, so they wouldn't be able to sign into the site. Can they go to the website and see what's available to start with?
Absolutely. FSA Store is not an ASIFlex company. We just partner with them on a lot of our business. So you can go to fsastore.com, check out their site. You can order with them even if you're not enrolled with us. They provide, like Bob said, thousands of options. You'd be surprised what's out there. You can see an eligibility listing similar to ours available on our website. But what's great about theirs is they actually, and now that the CARES Act allowed more options to be eligible under the plan, such as those over-the-counter medications and menstrual care products, you won't see this as an issue as much. But if something such as certain vitamins which are not eligible without a doctor's letter of medical necessity, it'll show a little RX blue in there, so you know it's not quite eligible. And if it has a red box with a check mark, it'll be eligible. So it's a popular site. They're very quick on turnaround time for deliveries, and it's very useful. If I'm at the store and I'm not sure if something's eligible, I'll pull up that website, take a look, and check it out there if I can't find it on our eligibility listing. But it's just fsastore.com. You can go there at any time. And that cardless pay option that Bob was talking about, like we said, it rolls out Monday. So what that'll do is if you're already enrolled with ASIFlex, you'll have that option as soon as Monday. If not, then when you are enrolled, that'll become available. You simply log into your account detail. There's a button for the FSA store. You click it, it'll direct you there. And when it directs you there, it'll ask you if you want to connect your account. And it'll take you through the steps to do so. I've done it myself. It's pretty simple. And then you just go through, fill your cart. When you go to check out, and doesn't have to be every time. Once you connect it, it's connected going forward. So anytime you go to the FSA store, fill your cart, go to checkout, it'll ask you to either input a card option or choose your ASIFlex account. And if you select ASIFlex, then your payment for the FSA store just comes directly out of your account. No additional documentation is needed because of our partnership with them and their inventory control system. They provide us all that information. So it's really simple. And like I said, you really get that. I've ordered things from them and got the next day at times. So they're really quick on the turnaround time depending on the season. But did that answer your question for them?
Yes, yes, thank you.
Perfect.
For the covered OTC drugs and medicines, does that include common supplements like daily multivitamins?
Some multivitamins are covered, but primarily for pregnancy. Otherwise, regular vitamins, because they're a supplement, they're not necessarily needed medically. The IRS does regulate that they require additional documentation from a doctor stating a medical reason. So if you're just wanting to take vitamin C daily just to help boost your immune system, unfortunately, that would not be eligible. But if you have a condition that a doctor has recommended you take vitamin C daily to assist with, you can get a doctor's letter of medical necessity for that, submit it to us with your claim, and we'll note that on file for the plan year, and that'll be available to you. You might still have to submit a receipt anytime you purchase it if the card doesn't allow you to use it based off the inventory control system, since it's not normally an eligible item, but we'll have it noted so that we process it when we receive those claims.
Great, thank you.
Mhm.
The next question is actually more for me, so I'm going to answer this one myself. Someone asked if so this year, due to the pandemic and part of the CARES Act that was passed at the federal level, we made it so that anyone can change their election during the year without a qualifying event. So basically, if someone was in a situation, this is definitely impactful this year in terms of dependent care. I know personally, I had daycare monies put aside that I never used because the daycare didn't open. So this allowed the opportunity to change your election at any point during the year. If you are looking to stop or change your contribution or your election at the beginning of the year, get in touch with the benefits team. Or you can go on to the DHR website and you can download the forms there at the benefits site. You can download the necessary forms to fill out and stop the contribution. Or you can get in touch with the benefits team. They can walk you through the process on how to stop the contribution. It's sort of the follow-up to that question was dependent care and whether you can roll over money using the dependent care. Unfortunately, you can't do that. That's a federal regulation. That's not a plan choice. Dependent care monies have to be used within the year that they are put aside. So unfortunately, we cannot allow rollovers year over year with the dependent care. I think that answers those two questions. Let's see. The next question is when carrying over funds. Oh, this is a good question. When carrying over funds, does that go against the maximum limit? So meaning if someone were put aside $2,750 next year or elect for $2,750 next year, and they rolled over $550, would that count against the $2,750, or would they essentially have, if I'm doing the math right, $3,300 to use in 2021?
The carryover would be in addition to their election. So they would essentially have that, I think you said 3,300 available under the new plan year.
Okay, great. There's been a couple questions about the recording of this. We are recording this session, and I've been trying to record all the sessions so far this week, and I plan to do the same for the Thursday and Friday. At the end of the virtual benefits fair, which is this week, so I'm hoping next week I'll be able to put up somewhere on our website all of the presentations, all of the recordings of the presentations, all the slide decks, any follow-up information, basically all in one location so that people can watch any of the presentations and read over any of the slide decks there. So I can't promise on a date, but I'm hoping very much to get that done next week. Let's see. Any other questions? I see one more that I'll answer in the chat. But any other questions from the group, either in the chat or on the phones?
And just as a note, real quick, Clark, I did mute everybody during the presentation. So if you have a question over the phone, you'll need to unmute your phone.
Thank you. Okay, so the question that was asked to me privately, I might as well just mention this to everyone else as well. As you know, when Bob started the presentation, he mentioned that this is something you have to sign up for each year. It's during our open enrollment period, which is starting in just a few days, starts on November 1st and runs through the end of the month. So the month of November is our open enrollment period, and that's when you can change or enroll in any of the benefits. It's done online through the VTHR system. And that is, again, kicking off on November 1st. And that's when you can go in and make your election for 2021.
Clark, I did see one more question in the chat that looks like it got missed. The question was, what do we need to submit to be reimbursed for mileage to and from a medical appointment? So it's a good question because mileage, many people don't think about it, but it is eligible under the plan to claim your mileage to and from providers and pharmacies if you need to go pick up your medication. So to submit that, you simply need to fill out the claim form. We do not need supporting documentation. If you are wanting to submit via mobile app or online, as you may know, it does require you to upload something. You could upload a blank document. You could upload, something that just says mileage. If you want to write it out on that document, that's fine. But we are looking for the dates you went to the provider you visited. So if it's one provider multiple times throughout the plan year, you can put a date range. That would be fine. Then we are looking for the total number of miles to and from that provider. And then you take that total number of miles and multiply it by the cent per mile set by the IRS. So for 2020, the cent per mile is 17 cents. Unfortunately, I do not know 2021 cent per mile yet. The IRS has been making updates over the last few days in regards to amounts. I imagine we will get that pretty soon, but I don't have it in front of me currently. So essentially, if you traveled 100 miles cumulative over the year to and from a provider, you would put in 100 miles and then you would multiply that by the 17 cents. So that would be your total amount that you're claiming for. And I believe that should be simple for me, but just to make sure, it would be $17. So I didn't want to accidentally say $1.70 and be off. My coffee's still kicking in, but $17, and that's the amount you would put on your claim form. And it's just as simple as that. And we'll reimburse you based off that information. Now, if you're going to a provider and you have to pay for parking, you can actually be reimbursed for that as well, but we do request the parking receipt to support what that amount is. Or if you take a cab or a bus to the provider and you have a receipt for payment, you could submit that. So the transportation to and from that you're not paying for via your own vehicle, that can be submitted with receipt for reimbursement. But if you're taking yourself via your own vehicle, you just submit that mileage.
Kalina, you might want to also include that you can submit this anytime during the year, but it's a nice method to use to submit it when you're submitting claims for that provider call that day, so you don't forget about it or it doesn't build up and then you don't do it. Just do it in association with the provider call that it pertains to.
That's a great point, Bob. Thank you.
All right. right. And apologies to Karen for missing that question. Thank you, Kalina, for catching that one. Any other questions? I think at this point we have answered all the questions in the chat. If you are on a phone and would like to ask a question, please feel free. Just make sure to unmute yourself first. All right. Well, I'm not seeing anything come through. So I want to thank both Kalina and Bob for spending some time with us here and going over the flex spending account and the dependent care account benefit. It's I found it very interesting. I hope everyone else did as well. And just a reminder that tomorrow, again, from 12 to 12:45, our vendor will be Northeast Delta Dental. And please join us if you can. Thank you again and have a great rest of your day.
Thanks, everyone. And as a reminder, if you have any questions come up, feel free to contact our customer service department. You'll get a live person and they should be able to assist you with any questions you may have.
Bye.